I think my team would describe me as dedicated and committed, and I think that I lead by example, and I think my clinical team on the ward would describe me as a good holistic geriatrician who is kind to her patients. So my name is Ruth Hubbard and I am the head of school at the PA Southside Clinical Unit. So my role is to be responsible for the Phase 1 and Phase 2 students who are at the PA Hospital, Redlands Hospital and QE2. So my goals for the next 6 months are to try to secure some dedicated space for the Phase 2 students over in the main building at the PA Hospital, and to restructure the teaching staff here a little bit to have more clinical academic registrars responsible for day-to-day teaching for the students. So I think my relationship with the clinicians and the executive staff at the PA Hospital, Redlands and QE2 is absolutely integral to any success I have in this job. So I see that partnership as underpinning, the best student experience we can provide for particularly for our Phase 2 students. When we are so reliant on the goodwill and the expertise of our academic title holders to teach and to give back to the students some of their skills and knowledge. So my vision for the PA Southside Clinical Unit is to make this a centre of excellence for teaching and learning. I want the clinicians to feel that they have the knowledge and skills to provide an excellent standard of teaching, particularly for the Phase 2 medical students, and for all the students to feel that they're embraced and welcomed onto the ward, and for their teaching to be personalised and individualised to meet their own goals. One of my proudest achievements here at UQ is setting up the How to Be a Better Teacher course. So this was based on a course that my predecessor Helen Benham started, and it was based on the feedback from clinicians that they wanted to understand more about educational theory and innovative strategies in assessment and evaluation. So we ran that in the second half of last year, and attendance was really very high, and we've decided to do that again this year, but instead of doing it once a week, we'll be setting it up as modules all together in one Saturday in November, Saturday the 4th I think. So if any clinicians wanted to come along to that, they'd be very welcome. Something my colleagues don't know about me, and they will not be suspecting this after the performance of my team at our recent trivia night, is that I did win a quiz once a few years ago, which was a radio quiz, and the prize was a trip to New York on Concorde. So it was a few years ago, but it was the best weekend in my life.